Over 80% of Canadians now live in urban areas. At the same time, the federal government will spend over $200 billion this year treating people who are already sick. So I'm here to ask the question, how can urban planning and design help prevent people from getting sick in the first place and build healthier communities? So my study will involve measuring built environment indicators and linking them to health outcomes. But to understand the context, I want to tell you a quick story. Let's imagine you live in a community called Carville. There are no sidewalks, there are no grocery stores within walking distance, and you have to drive 90 minutes to work every day. Over time, you become overweight and obese, and you develop a chronic health condition. So you're not living in an active city. Your commute makes you angry, and over time you become depressed. So you're not living in a happy city. In addition, you don't know your neighbors because there's no community centers and no parks. So you're not living in a resilient city because you're vulnerable and alone. So just like doctors can use x-rays to measure what's wrong with your body, my study will use Geographic Information Systems, or GIS, a mapping tool to map built environment measures listed here, which I will then link to health outcomes. And just to give you some examples, distance to grocery stores, mix of land uses, access to safe cycling routes, or access to parks and green space will be calculated for 105 neighborhoods in the Metro Vancouver region. Those same neighborhoods, I have data on health measures from the My Health, My Community survey. This was a unique population-level survey. It included 30,000 responses, and it was looking at questions related to physical health, such as activity levels or healthy food and fruit and vegetable consumption, social health measures, such as number of peer connections and overall sense of community belonging. In addition, mental health measures, such as anxiety and depression. So I hope by understanding these relationships and understanding which ones are significant, I will be able to help urban planners and public health professionals partner to improve the existing communities and build new communities that help people thrive. Moreover, I believe this data will support more evidence-based community engagement and decision-making that will help build more active, social, and resilient cities. Finally, I believe a little prevention can go a long ways, and that by investing in healthy communities, we will also increase the prosperity and sustainability of our cities. And more importantly, we'll be investing in the health and well-being of the future generations to come. Thank you for your time.